if you do root canals, you know how difficult it can be to set everything up and use the right irrigant, or you hope you're using the right irrigant, because that so determines our success. And what I want to do is just spend a few minutes here talking about kind of efficient and effective endodontic irrigation, just an overview to simplify it for, I hope, all of our listeners. So it's not easy. And just to kind of share with you the statistics, is there's about 15 million root canals, and it's even greater today. These are older numbers that are performed each year. And if that's true, that's about 41,000 procedures per day. Now, there's a limited number of endodontists, about 6,000, that actively practice in the US, which means that 70% of the root canals are done by the general dentist. And what I want to do is I want to just help make this easier for all of us to do. Here's an example of some tooth models that I use when I'm teaching endodontic courses. And here on I'm going to get my little laser pointer set up here. There it is. So here we have a side view that we normally are used to seeing, and we have the root canal system that goes down the roots of the tooth. Well, we don't see that part. What do we see after we've made our access up on the coronal portion of the tooth? Is we look down in there and we're looking for the orifices, and they are not easy to find. So we know we have these little orifices, and in this tooth there's 3. So we're through those little orifices, we're supposed to clean out the entire canal system, all the lateral canals, all the little tubules that go out laterally from the main canals. It is not an easy job. So one of the things that we're going to talk about today is endoirrigants, because when we do our root canals, we're relying on our files, typically metal files that go down the main canal. So if I'm dealing with the molar that we just saw, we have 3 main canals, and I'm trying to get all the tissue and everything out of those main canals. And if you go back 4 decades when I was learning how to do a root canal, I thought that was really the main purpose. But now what we know is that off those main canals, a lot of times there's fins, lateral anastomoses, all the tubules in the walls of the canal that we have to get cleaned out. So we've got our metal files, but now I have to use my irrigants. And one of our R&D team members, he described this as liquid files, that we actually put liquids, irrigants down into the canals to do the other part of the cleaning. So in this study that's often quoted, Dr. Peters did a study, and if you take stainless steel instruments and nickel titanium instruments down those main files and try to get everything out of there, about 35% of the canal walls remain untouched. Why is that? Well, because of the shape of the canals. Our files are usually round in diameter, and the canals sometimes are very thin, oval-like. There's all these lateral canals that come off the sides, and so those little anatomic differences make it very hard for the files to clean everything out completely internally. So we go to our liquid files. And in the past, what we've used, when I was in school, we were taught to use Clorox bleach. So go down to your supermarket, buy a jug of Clorox bleach, dilute it 50-50, and use that, because that's sodium hypochlorite. Well, today we have pharmaceutical-grade sodium hypochlorite. So what's so good about this? Well, remember, sodium hypochlorite we put into canals because that dissolves the tissue, basically turns the tissue into soap, and so we irrigate. And then we do some more filing and we irrigate. The other thing that this liquid does is it lubricates our files as it goes up and down, and as we create these particles inside the canals, the liquid suspends the particles so we don't pack everything down into the apex of the root canal system, and it kills the bacteria as it's dissolving that tissue away. So the sodium hypochlorite's action is very important to the success of our root canal. So I don't want to use the Clorox bleach, because one of the things that we've learned about Clorox bleach is we don't know anything about it. We don't know when it was made. We don't know how long it's been sitting on that store shelf. It doesn't have a shelf life. We don't know what the concentration of sodium hypochlorite is in that bottle of Clorox bleach. It's not pharmaceutically controlled. So today we can get pharmaceutically controlled sodium hypochlorite. So it has a shelf life, and we know that it's going to be effective. So here from Vista Apex Solutions, we have sodium hypochlorite. It's available in the 3% and 6% concentrations. I actually use both and haven't really noticed a difference. And in literature, it's hard to discern. Some people weren't using 3% because they didn't feel it was high enough concentration, and some people were afraid of 6% because they're afraid if there was a sodium hypochlorite accident that it could create more tissue damage. I would just tell you, I think you can be when you use a pharmaceutical grade sodium hypochlorite, I think you can use 3% or 6% interchangeably, as long as you're safe. Because at the 3%, you know you've got 3% because this is pharmacy controlled type of sodium hypochlorite. Whereas if you get a bottle and it says 7 or 8%, it might be 7 or 8%. So if you dilute it down, you're going to be somewhere between 3.5 and 4%. Or maybe because it was transported from wherever it was stored to that store during the summer, as exposed to heat and sunlight, that 7 or 8% could be down to maybe 2%. And then you dilute that, and now you're basically down to water. So that's why I think when you use a 3% concentration of Vista Apex solution, sodium hypochlorite, you're going to be okay. Now it's interesting because a chart to our lower left just shows you some of the primary irrigants used: sodium hypochlorite, EDTA, chlorhexidine, saline, MTAD, and citric acid. Why do we recommend sodium hypochlorite? Because sodium hypochlorite will actually dissolve and disinfect the canal system. It will dissolve that tissue away. So although you can use other fluids just to rinse out the tissue, if you really want to dissolve that tissue, you have to use sodium hypochlorite. I know some doctors will use anesthetic solution because it's sterile and you're numbing the nerve up as you're removing it. Well, good thinking behind that. The only drawback is that you're not going to dissolve that tissue and really disinfect it, because that's not what anesthetic does, right? Anesthetic, it can be sterile and it's a liquid. It's going to provide anesthesia but not dissolve tissue away. So what I'd recommend, because we don't know what the true concentration of that Clorox bleach is don't use Clorox anymore. We now have better alternatives. Use sodium hypochlorite that you buy from a source where you know it is validated in its concentration. So the Vista Apex sodium hypochlorite is pharmacy controlled for consistency and safety. Because if you think using good sodium hypochlorite and you're not dissolving the tissue away, you go through all the trouble, and your patient sits there and lets you go through all the trouble of cleaning that canal or canals out, and then you seal it up and you haven't dissolved all the tissue, or you haven't completely disinfected that canal, and now it fails to heal. That's not a good thing. So let's put all the odds in our favor. Let's do everything, and this is a small thing. Let's do the small thing to try to make sure that our root canals heal up like they should. So we have verified concentration. It's quality controlled. Now we know it's going to dissolve the pulp tissue because we know that the concentration is going to be at 3 or 6%. And we also know that once we go past that shelf life, we should discard that solution and get some fresh solutions so that we can get the intended clinical use, right? I'd hate to tell patients, sorry, that root canal didn't heal up. You know, the material I used, I don't really know how effective it was. It was supposed to dissolve that tissue away, but maybe it didn't. You know, I just bought Clorox bleach. Your patient, when you think about that in their mind, is, well, isn't Clorox just to whiten my whites, not really to clean out my tooth? And they're right. So when we're done with the sodium hypochlorite, we get all that tissue out, we dissolved it, we disinfected it. Now our instruments going up and down, whether we use hand instruments or rotary instruments or reciprocating instruments, creates a lot of debris. And that is what we call smear layer, or the dental mud. And if we're using a biactive ceramic sealer, which most of us are today, that will actually bind to the canal walls, kind of like if we open up all those tubules. So it's like doing a composite restoration. When we prep a tooth, we know we have the smear layer that's occluding all our tubules. So what do is we put our phosphoric acid etchant across the tooth, we rinse it off, and now the tubules are opened up. Now we have our micromechanical retention that our adhesive and our composites can adhere to and give us a good adhesion to the tooth. Well, the same thing is with the root canals. When we obturate this and we seal it up, we want our sealer to really bind to the walls to prevent the bacteria from being able to climb back up the tooth and that root canal system. So what we have to do is we have to so-called etch the canal walls, and we do that with our EDTA. That removes the smear layer and the dent and mud so that our bioceramic sealers can actually adhere to the canal walls. So it opens up the dental tubules and enhances the cleansing. And the EDTA from Vista Apex Solutions has an optimized pH, because what we found was it's not the concentration, 17% or 18%, that makes a difference. It's the pH. If the pH is the correct pH, you're gonna be able to remove more of that dental mud. So that's what we need to do, is we have to have an EDTA that has a proper pH, and that way we're going to get more effective action. So this is just showing how On the right-hand side, we have an EDTA that was applied to that dental mud, but the pH is 11.56. It's too basic. It's not removing any of, or chelating away any of that dentin mud. Whereas on the left-hand side, we have Vista Apex EDTA that has a pH of 8.5, so still basic, but that pH will lift away all that dental mud. It'll attract it, chelate it, and open up the dental tubules. So now if I was using my sodium hypochlorite and all that dental mud was sealing up those tubules like we see on the right-hand side, our sodium hypochlorite could only be so effective, right? Because the bacteria behind that muddy wall, we're not really accessing very well. So what I do is I use the EDTA. The EDTA opens up the tubules like we see on the left-hand side. And now if I go back in with my sodium hypochlorite one last time and I agitate it, when we work it into those little tubules, if there's any bacteria hiding in those little spaces, we're going to find it and we're going to get it, right? So that's what the thinking is behind this is good sodium hypochlorite, EDTA to get rid of that dental mud, open those tubules up, sodium hypochlorite once more that we activate with the Endo Ultra that we've covered in previous programs to get all the bacteria that could be hiding in those little tubules, and then we seal everything out with our bioceramic sealer. It is kind of the recipe for success when you do a root canal. Now, when I was learning how to do root canals with our hand instruments, we used to just use our fingers, right? We're going from a 8 file to 10, 15, 20, 25, 30, 35, 40, 45, sometimes even up to 60, because back then we really had to open things up really well. Well, today we're doing more minimally invasive root canals, so we sometimes don't go past a 30. And we're also using rotary and reciprocal files that we can put on a handpiece. So we get done with these root canal procedures much faster than we did before. Before, if I was doing a molar, it could take an hour and a half or 2 hours because I had to find all the canals, I had to enlarge the canals, and then I had to seal them up. And it might be one visit, it might be 2 visits. But if I was using my sodium hypochlorite, the sodium hypochlorite had an hour, let's say, out of that 2 hours to really dissolve the tissue and disinfect the canals. While today, if I'm down to a 20-minute procedure, we have to be much faster. So what does this Apex do? They come up with a better sodium hypochlorite. So this is, Clorox is basically sodium hypochlorite 6% that has proprietary surface modifiers, wetting agents, that help it penetrate into lateral canals and to dissolve the tissue even faster. And so it's going to dissolve the tissue 2 times faster, which is great for us, right? Because if I'm doing my root canals twice as fast as I used to, I get a molar done in 1 hour instead of 2 hours, I need to have an irrigant now that will keep up with my instrumentation. So it's going to work 4 times faster than a competitive sodium hypochlorite. It's going to reduce the treatment complications. It's going to, because the surfactants are going to improve the contact with the tissue and the canals, we're going to be able to dissolve more tissue. We're going to have better lubrication from this because it decreases the surface tension. So Chlor Extra is, in my book, a game changer because it really helps us be much more efficient than we used to be before. So what you see here is the surface tension is decreased. Chlor Extra has decreased surface tension, which is good. What does decreased surface tension mean? Well, imagine you had water and oil, right? And you put the two together, they don't mix because the surface tension between the two doesn't allow that. So if we take some soap and we put a drop of soap in oil and water, that breaks the surface tension, all of a sudden the two emulsify or they connect together. And that's what these surface modifiers in Chlor Extra do. It helps our sodium hypochlorite action penetrate into the tissue, so we dissolve the tissues faster because we make better contact with the tissue and all the walls on the side of the canal. So the diagram on the right-hand side just shows that they were able to show more tissue dissolution, basically, using Chlor Extra than 6% sodium hypochlorite. So another reason, because we're so much more efficient with our root canal procedures using our rotary and reciprocating file systems, that we need to have an irrigant that can keep up with us. Now remember I was telling you before, we use sodium hypochlorite to dissolve the tissue, and then we use EDTA to remove the smear layer, all that mud inside. Well, a third part of that, some clinicians would use chlorhexidine as kind of the third part because that was kind of a broad antibacterial type of medication we put in the canal, seal it up, and the clinicians believed, hey, we're going to get better success because if I left any bacteria behind, the chlorhexidine is going to help take care of that. Well, today we've come up with something better because The problem with the chlorhexidine was it was another step. But if you had your sodium hypochlorite and you mix the sodium hypochlorite with your chlorhexidine, you would get a reddish brown precipitate that some said could be carcinogenic. It could discolor your tooth, and that was just not a good thing. So you had to remember, if you're using sodium hypochlorite, to use the EDTA, maybe rinse out with some sterile water, alcohol, and then use your chlorhexidine, not mix the two together. And then if you use the sodium hypochlorite with the EDTA, you weren't getting the action of the chlorhexidine at the end. Well, Smear Off 2-in-1 has made this much easier. What is it? It's a proprietary mixture with your EDTA and your chlorhexidine all in one bottle. And again, it has the wetting agents and the surface modifiers to decrease the surface tension, so you'll get even better smear layer, the dental mud removal, and you don't have to worry about rinsing it out. So if you go from your sodium hypochlorite to your EDTA with your chlorhexidine mixture, you don't have to worry about the sodium hypochlorite and the chlorhexidine mixing together and creating that precipitate that you don't want to have there. So it simplifies things, but you also get the action of the chlorhexidine at the very end. So you still are using 2 syringes, one with your sodium hypochlorite or your Chlor Extra, and then one with Smear Off now, but you're really getting the action of 3, which would have been your chlorhexidine in a 3rd syringe. So this just makes things more efficient, and what better, it increases the predictability of this procedure. So look at what with these surface modifiers. Here's the open tubule percentage. So basically, when you have that dental mud in there, all these tubules are closed up. You want to remove that dental mud and open up the tubules, right? So the higher these bars are, the better. So Smear Off, which is the purple, has the highest bars in the coronal third of the tooth or the root canal system, the middle portion of the root canal system, and the apical area of that root canal system. And you compare it to the competitors, even saline. Saline doesn't show up because it does nothing, right? But you can see a Smear Off is just very effective to clean everything up. It does a very nice job. Now, what Vista Apex Solution is also doing is it's color coding the syringes. Because in my office, what my assistants would do is they'd fill up the syringes, but we just had the white clear syringes, and they'd put sodium hypochlorite in one, EDTA in another, and have to label the syringes. And if they forgot to label the syringes or we got them mixed up, I wouldn't know which one was sterile water versus sodium hypochlorite, right? So now it's the sodium hypochlorite and the Chlor Extra, which is basically the sodium hypochlorite 6% with all the surface modifiers. They have the same action. They have red bands on the bottles. So you put those in the red syringes. Your EDTA and your Smear Off 2-in-1, which is your EDTA and chlorhexidine, these bottles both have blue bands, so you put those in the blue syringes. So no longer do you have to label your syringes or worry about them getting mixed up. Red is going to be your sodium hypochlorite, and the blue is going to be EDTA. Or red's going to be your Chlor Extra, and blue is going to be your Smear Off. It's going to make it much easier and safer for you and your patients. Now, as we're delivering these irrigants, we can. I used to have all kinds of different tips, right? And delivery tips, dual port, single port, different gauges. It was just confusing. So what Vista Apex Solution has done is developed what we call the VIP tip. And this VIP tip is a 29 gauge needle that comes in 2 different sizes, a 27 millimeter and I believe a 17. And they're pre-bent lure locks, so they go right onto your syringes that you fill up with your irrigant. And they have the stopper, so you don't have to put a stopper or guess at the depth that you're placing your irrigant. You can just measure this out. But the key part is having the dual side port delivery. So no longer at the end where you have to worry about a sodium hypochlorite accident because you shoot that sodium hypochlorite out the tip of the root. But now we have side port delivery, so it's going to be much safer. And we have 2 side ports, and that having 2 side ports helps to decrease the amount of pressure it takes to deliver that irrigant into that root canal space. Because sometimes when you have a single side port and you're trying to express it, it takes a lot of pressure and you're trying to control it because you don't want to bind it into the tip of the root, but you're kind of pressing the syringe down into the root. Having the dual side port just helps to make this easier to do. So what I've covered really quick is just one of the systems to create success. We've got pharmacy-controlled irrigants. We have advanced irrigants over here that has surface modifiers, so they will work faster. They'll be more efficient, more effective. We have color-coded syringes, making your job and that of your assistants much easier and safer. And we have these dual side port irrigation tips where you just have to order the VIP tips. You don't have to stock an inventory of half a dozen different tips. It makes our job so much easier. So this system just helps to make our success better, more likely, more dependable. So Vista Apex Solutions is a market leader in endodontic irrigation, developing innovative products that dissolve the tissue and thoroughly cleanse the root canal systems out even better, even in the most difficult tooth anatomy. The endodontic irrigants and solutions are specially formulated to remove the debris and the bacteria more effectively. And if we do that more effectively, we ensure the success of our endodontic procedures and a healthier tooth for our patients. And when we're doing a root canal procedure, we want that to always succeed. And the solutions I talked about are compatible with whatever file system you use, because whatever file system you're using, we need to use the irrigants to get into those small spaces where our files cannot reach, like Dr. Peters showed. And these irrigants are compatible with all the different systems. So I hope this information helps you. I hope it simplifies the way you think about irrigation. I hope it helps you understand the importance of irrigation and why you have to use something like sodium hypochlorite and EDTA to effectively do a successful root canal. Anyway, I thank you for listening to this program. I hope you hit the like. I hope you will share it with colleagues. We're trying to create a community of like-minded individuals, trying to do the very best for our patients. And I look forward to seeing you during our next program. Thank you very much.